Hi, I'm Anna from Psych VA, and today me and Clare Veal from Aubergine Legal are having a chat about clinical wills, or as we call them, clinical continuity plans.
I'm Claire. So, as Anna said, I'm a solicitor and I run my own legal consultancy, Aubergine Legal, and I've been helping psychologists for the last 6, 7 years. And Anna and I have been talking about clinical wills for a while now. So, yeah, we're here today to unravel all of the bits and bobs about what you need to think about.
Clare, would you like to explain what a clinical will actually is?
Yeah, well, a clinical will isn't actually a legal will at all. It's more accurately, a business continuity plan. That's one of the reasons why you shouldn't be calling it a clinical will. It should really be called a clinical continuity plan because basically it's a practical document that you should set out, explaining to somebody what should happen to your practice and, most importantly, your clients if you become seriously ill or if you sadly pass away. So I suppose it's more of a sort of business continuity plan for therapists.
And I know that when you spoke to the probate lawyers, they were quite adamant that it shouldn't be called a clinical will.
No, because it's a bit confusing because, a will has an actual meaning in law. A personal will deal with your assets, your property, your family arrangements. A clinical will is more of a sort of document that should sit alongside your will. It's more what's known as in the probate laws as a letter of wishes, and it should sort of set out it should explain to the executor of your actual will what should happen with respect to your business, but it's not actually a legal will in itself. It's more of sort of directions, I suppose, as to what the executors or the people running your estate should do with your practice.
Why do therapists need one? Obviously, they're mandated and they should have one as according to the professional bodies that they're registered with. Um, but yeah, what's the purpose of it?
Well, I suppose like we said, some of the regulators require it, but some don't. But for the ones that don't, you should still consider putting one in place 100% because it's more of an ethical issue. If
Mhm.
you suddenly can't work, if you become seriously ill, then, your practice is going to be left without support. Your clients will be confused. They won't know what's happening. They might be vulnerable clients, they're coming for therapy for a reason, they might need their therapy to continue for their own well-being. And so without having a clinical continuity plan in place, they'll be left in limbo because it will be down to the executor of the will to sort out, and that could take a long time. And so they'll be left without receiving therapy for a long period of time. And if they're vulnerable, that's not good. So by having this clinical continuity plan in place, you can get the ball rolling on, getting your clients transferred to another therapist so that they're not left without any help. And also, it's a good thing to do. It makes you look professional. It makes, it looks like well, it shows that you care about your clients. You're being ethical. You're thinking about what will happen if things go a bit pear-shaped, and it will enable someone to do a smooth handover. It also shows your regulators that you're acting in your client's best interests, which will be part of your code of practice as well. And, even if you're just a solo independent practice, or if you've got a team, it doesn't matter. Either way, you still need to be thinking about your clients and what's going to happen to them if you're no longer able to provide therapy yourself.
Yeah, that's right. And I've seen this firsthand when I've been working with a client. Thankfully, nothing that bad happened, but she did have to cancel her sessions because she was poorly for that day. And we couldn't get in contact with all the clients. And so one of them turned up at the clinic. And I was quite surprised at, the impact of that. Because this client was thinking that she'd done something wrong, that a therapist didn't want to work with her anymore, and she was genuinely upset by this and not being able to reach a therapist. So yeah, I've seen what it can do to, clients, patients, from who are vulnerable and from that aspect. So yeah, to make sure that someone can quickly access your data and in the event of something unfortunate happening, and be able to contact your clients who you've got people booked in that week, to be able to let them know the situation in an appropriate manner, and so they're not turning up at their appointments and then their therapist not being there.
Yeah, I mean, yeah, like you say, especially clients who suffer from anxiety, it's gonna, it's gonna escalate things in their head. So yeah, just by making that quick phone call, letting them know, if there's somebody that can let them know what's happened and rearrange the appointment, it's just gonna be nicer for everybody, isn't it? It's very
Absolutely.
professional as well.
Yeah.